Hello, this is an analysis of case study 5.3 by Hannah Japalis for Life Cycle Nutrition at American University. Multifetal births have become increasingly prevalent in the last several decades. This is largely due to the more mainstream use of assisted reproductive technology like in vitro fertilization. This is because these methods increase the number of embryos that are transferred to a woman's womb. Furthermore, women are having children older, and above the age of 35, the chance of twins increases. Because multifetal pregnancies are rising, it is more important than ever for women to understand the increased needs and risks that are associated with such pregnancies. In this case study, we will examine one multifetal pregnancy and some associated problems, which can be easily solved and help others to learn. Here is a summary of our patient. Ms. Mendez is 37 years old and was in her 23rd week of her second pregnancy when she found out she was having twins. Pre-pregnancy, Ms. Mendez was a normal weight of 142 pounds. Some concerns her practitioners have are the following. Ms. Mendez has had trouble gaining weight as scheduled during the first half of her pregnancy. This has been due to morning sickness inducing nausea and vomiting. This is of heightened concern since she is birthing 2 children and therefore has increased nutritional needs even above that of the average pregnant woman. Furthermore, Ms. Mendez's diet is lacking in EPA and DHA. These omega-3s are essential for the development of the fetus's brains, eyes, and central nervous systems, making them of unique importance for pregnant and lactating mothers. The final concern is that her 25 hydroxyvitamin D level reads low. This has been associated with preterm birth in multigestational pregnancies. Nutrition is thought to play a very significant role in the outcome of twin pregnancies in particular. Appropriate weight gain is a big part of that. Ms. Mendez is behind on weight gain, but luckily, twin pregnancies have been extensively studied and the findings can help her restore the health of her pregnancy. Ms. Mendez has gained 14 pounds so far in her pregnancy, so she will need to gain another 30 to 31 pounds in order to meet the midpoint of the recommended gain, which is 37 to 54 pounds for a normal weight woman with a multifetal pregnancy. Ms. Mendez has 12 weeks left in her pregnancy, so her goal will need to be to gain 2.5 pounds per week for a total pregnancy gain of 40 to 45 pounds. This is comfortably within the recommended range of 37 to 54 pounds. Given all the information, I would diagnose a number of things that need to be solved for and monitored. First, Ms. Mendez has inadequate caloric and nutrient intake or retention. This is due to morning sickness causing her to vomit regularly. Next, her fatty acid status is poor. This is due to lack of consumption of enough EPA and DHA omega-3s. Finally, Ms. Mendez has a vitamin D deficiency. In order to resolve Ms. Mendez's pregnancy problems and restore health, the most important thing will be getting her vomiting under control so that she can retain nutrients. I would recommend some natural anti-nausea remedies such as ginger tea, eating small, more frequent meals, and possibly taking a vitamin B6 supplement, which is known to reduce feelings of nausea. If she's not already, Ms. Mendez should begin taking a prenatal supplement as well. In addition, she'll need to improve her omega-3 levels, for which I would recommend a supplement because the main dietary source of these fatty acids is through fish, which pregnant women are limited in eating. Finally, a vitamin D supplement will be necessary, even with a prenatal vitamin, because the vitamin D in a prenatal is not enough to restore homeostasis from a D deficiency. Last but not least, it would be my recommendation that Ms. Mendez sees a nutritionist or nutrition educator regularly. In order to monitor her progress and evaluate the efficacy of the prescribed actions, I would recommend that Ms. Mendez has weekly visits with a nutritionist to track weight, food intake, and progress on morning sickness. Furthermore, I would order bi-weekly blood work to assess whether omega-3 and vitamin D levels are improving. With the previously mentioned recommendations in place and ongoing evaluation, Ms. Mendez should start to improve and ultimately birth healthy twins at 37 weeks. Thanks for listening.